Namaskar, Sat Shri Akal, Adab. Good morning, good afternoon, and good evening. Thank you for joining our live session. My name is Kunjan. हमें आपके host और those for today's live session. New feature that eGlobalDoctors have just added and are coming up with new project called eGlobal Ayush. The project is for Indian folks working in USA, UK, Australia, Europe. You don't have to worry about your parents back in India. eGlobal Ayush packages help provide medical services needs for NRI parents in India. For more information, visit eglobaldoctors.com. In today's live session, we are exploring and providing more information about VTE, aka blood clots, and this is part 2 in conversation with Dr. Anup Katyal. Dr. Katyal, he's someone who doesn't need an introduction. He's an ICU critical care expert, board certified in 5 specialties: internal medicine, sleep medicine, critical care medicine, neurocritical care medicine, over 25 years of experience. It's really nice to meet you virtually, Dr. Katyal. I know you're super duper busy. Welcome to our session. How are you doing this evening?
I'm doing good. Thanks for having me back.
It's always a pleasure. Whenever you come, I know that my knowledge increases tenfold, and I'm sure our viewers are going to agree. So thank you so much. So, Dr. Katyal, like I said, this is VTE or blood clot. It has a fancy word. I'm going to leave the fancy word to you, and this is part 2. So if you can tell our viewers the fancy term for VTE, and if you can provide a little recap, so if someone is joining us today and they did not hear the first part, they know what VTE is.
Sure. So VTE stands for venous thromboembolism. And as we discussed last time, if you look at cardiovascular mortality in the world, VTE will stand third in that list. So acute myocardial infarction, stroke, and then VTE. So this is something not to be ignored. And when we talk of VTE, it essentially means blood clots in the venous system of your body. For example, it could be your legs or lower extremity, upper extremity, your lungs. And like we discussed last time, any venous system would also include, the veins that drain blood from your brain, and the veins that also drain blood from your abdomen. So those are not that as common, but when we say VTE, it includes all these venous system in your body.
Wonderful. Thank you for that recap. With that, I'm going to start my first question for today. So what are different types of VTE?
So this can be answered different ways. When we say VTE, the most common interpretation of that would be, is it provoked or is it unprovoked? Provoked means there was some risk factor that was there, which caused the VTE. For example, someone was immobile or had a fracture that led to the clot, then we say it is provoked. If it happens without any provoking feature, we say it is unprovoked. That would be one way of classifying it. Another way would be if we have, say, a blood clot in your legs, we could say it is acute, subacute, or it is chronic. When I say acute, it's usually clot within the first 2 weeks, and then 2 weeks to 4 weeks is subacute, and more than 4 weeks would be chronic. So that would be another way of, classifying VTE.
Thank you for that. So please do not ignore, like doctor mentioned, it's not something to be ignored. Now that we know what are different types of VTE, what or how can we treat VTE?
So the treatment of VTE, when someone has, I will just classify into, DVT, that is a clot in the legs, which is much more common than clots in the upper extremity. So that requires, one to take what we describe as blood thinners. And so as I had mentioned in the last talk, what blood thinners do is they don't do anything to the existing clot. They prevent new clots from forming. So that's a rationale for using blood thinners. So that would be for your clots in the leg. And also when you have clots in the leg, it depends, where the clot is. Is it above the knee or it is below the knee? So if it is above the knee, that is taken more seriously than if it is below the knee. In other words, if it is below the knee, in certain instances, you can, wait and see if there's any progression of the clot towards the proximal part of your leg. And then if it is above the knee, then you have to treat. As far as the clot in the lungs is concerned, that's a very, I shouldn't say complicated, but you have to risk stratify those patients, whether they are high risk, intermediate risk, or low risk. So if they are low risk, then they can be actually sent home on what we describe as an oral anticoagulant or a NOAC. But if it's intermediate risk or high risk, then management is more nuanced. If it is high risk, then you have to use what we call as clot dissolving drugs or thrombolytics. And if it's intermediate risk, then you have to admit them to the ICU and then watch them closely for any deterioration. So these people get blood thinners. And in certain instances, we can put catheters in and dissolve that clot through that catheter. And sometimes we can, through those catheters, suck the clot out, what we call as thrombectomy. So depending upon, whether it is high risk, intermediate risk, or low risk, after your stratification, you treat the patient accordingly.
It has such a small name, but look at all the different fancy treatments it's come with. So thank you for that insightful information. I'm sure people are gaining a lot of information. So we talked about types, we talked about treatment. Let's talk about the risk level. So what is the risk level for VTE?
So the risk level or risk factors are, based on some you can inherit and some you acquire. So when we say that there's a history of VTE in the family, then you look at certain risk factors. And the inheritable risk factors, the two most common, are called factor V Leiden and prothrombin gene mutation. The other things are like protein C, protein S, and antithrombin 3. And there are other factors like, immobility. That's a very important risk factor. If you are having surgery, that's a risk factor. If you have chronic conditions involving your heart, lungs, kidney, liver, that is a risk factor. If females are on oral contraceptives, that's a risk factor. Once you age above 50, that becomes a risk factor. We see obesity rampant in India, and people have undiagnosed, untreated sleep apnea. That becomes a risk factor. So those would be the risk factors that would have to be taken into account. But for all practical purposes, if you have a blood clot, the million-dollar question is that clot provoked or it is unprovoked? And like we will discuss, that if it is unprovoked, then in general, you have to treat the person lifelong.
That's interesting. Okay. So thank you for that. And you did mention about lungs and kidney and heart. So I'm going to ask a question related to heart, that can VTE cause a heart failure?
Yes, it can. Because when we talk of pulmonary embolism, that involves the lungs. And we know that anything that affects the lungs can have effect on the right side of the heart. So these people develop what we call as pulmonary hypertension, which then can cause the right heart to fail. And we know the right heart and left heart, they're sort of interdependent. So if your right heart does not work, then it can have a bearing on the left side of your heart too. So yes, PE can cause right-sided failure.
Okay, so that's actually good to know. So hopefully people who are listening to us gaining a lot of information. I just want to let you real quick, we are live, and we are live on Facebook, YouTube, Twitter, LinkedIn, and Instagram. So you can hop on your favorite social media program where eGlobalDoctor brings you new and interesting topics for you. And if you are joining us right now, we are in conversation with Dr. Katyal about VTE, and this is part 2. So going to my next question, can these blood clots in the veins, can they just go away on their own?
Yes, as I said, the whole purpose of treatment of blood clots is when we start a blood thinner, they don't do anything to the existing clot. The body's own inherent systems, they work in dissolving the clot. The purpose of using a blood thinner is to prevent new clots from forming. So a lot of times, this thing like my teacher used to say, what mind does not know, eyes never see. So if you don't think about VTE, this may be there and it may not be as bad as one may think, and a person may have it, and then the clot dissolves on its own and one doesn't even know that one had a blood clot. But if you have a blood clot, that's a big risk factor for developing another blood clot.
Interesting. So I have seen like our uncles or our grandfathers, they had these veins, the popping veins on the legs, the lower part of the legs, and some of them you couldn't touch them because they were painful, and after a while the pain would go away, but the vein will still look like a little fluff. I don't know the fancy medical word, but can the sensation just automatically go away, or are they painful all the time?
So that is an important question. One of the problems that we face with DVT is the complications associated with DVT, and that involves pain, swelling, and because these veins drain the lower extremities, you can develop venous ulcers, that is in the lower extremity, and also what you describe as varicose veins, that those tortuosity in the veins. So that can be a complication. And a lot of times, because the blood is not being drained, you can develop redness and etc. in your lower extremity, which we call as stasis dermatitis. So there can be all sorts of complications from, a blood clot in the legs or DVT.
So this is a complicated subject. That's what I'm getting with the explanation. So I'm going to move, since we talk about complicated subject, my question is related to that. So what are some complications that VTE can bring along?
So like I said, for the extremities, I mentioned the complications. And if you have PE, that is, pulmonary embolism, you can have complications. And we have more and more data coming out now from studies from Europe suggesting post-pulmonary embolism impairment. The most dreaded complication is what we call as chronic thromboembolic pulmonary hypertension. That is, your right-sided pressures continue to be elevated because of these small clots that are there all over your lungs. But studies have looked at it and said that people, like we mentioned, develop signs of right-sided failure, they develop shortness of breath, they develop chest pain, they have developed anxiety, they develop insomnia. So there are so many features associated downstream with pulmonary embolism as a complication, but that would be in your lower extremity and in the what you call lungs. But similarly, if you develop blood clots in the brain, in the venous system, then you can develop a bleed and develop severe headache in the brain. Or if it is in what we describe as superior mesenteric vein, that's the vein in your abdomen, you can develop GI bleed. And these are two situations where despite blood, you treat with a blood thinner. Means that would not sound something you would treat if you saw blood, but those are clots that need to be dissolved, and those clots are putting pressure. And so you need to treat it despite the blood that you see.
Thank you for that insightful information. Before I go to my next question, quickly want to tell the new feature that eGlobalDoctors is bringing to you, prescription shipping services. Now, this feature is only available in Georgia state, but who knows, next time we are talking to you, we might give you some more states where this is available. eGlobalDoctors have partnered with Sugar Pharmacy, LLC, Georgia, and they will be delivering medicine to the people of Metro Atlanta local community. For more information, make sure to visit eglobaldoctors.com. With that, I'm going to go to my next question. So we always say lifestyle, holistic. So what kind of lifestyle changes can help prevent a blood clot in our venous?
So the most important, I would say, is mobility. Like we discussed last time, when you develop a blood clot, there is a triad called Virchow's triad. That means you have to have stasis of blood, that blood is not flowing. That is, if you're not mobile, whether you're traveling by air, they say more than 4 hours actually becomes a risk factor. And the other thing is, if you have any injury to the vessel wall, and third is there should be a propensity for your blood to clot. So if you have those three things, then that leads to blood clots. And so in this day and age of travel, it's also called the economy class syndrome, where you travel long distance and then you can develop blood clots. So what I would say is, if you have any of the risk factors, one of the most important one is, lack of mobility. So if we are traveling long distance, even by road or any other mode, that is a big risk factor. So all you can do is, if you're traveling by car, for example, make sure you take breaks and you go for a walk and stuff before resuming your trip. So those are some things that you can do to prevent blood clots.
And I remember, I think I asked you the question last time because I sit in a chair for 8-9 hours, or if stuck in a traffic, 3 hours drive, then those are also contributing to the risk factor.
Exactly. That's very true. Whether you're sitting in a chair in a home, or sitting driving, or sitting in a plane, as long as you're not mobile. So even for home, if you can, you should get up and walk periodically. That is what I would suggest.
I'm going to put timers for myself so I can periodically walk. I get motivated when I talk to you, and then, I don't know what happens. I get, sucked into the corporate life again. So thank you for that reminder. Let me check if we have any questions on our chat. I don't see it right now. Okay, maybe I'll come back to it. So, how do I know, someone like me who does not have medical information like you, how would I know that I might have VTE, or how would I diagnose it? Like, how would I go or to see a doctor to figure it out if I have that or not?
So I'll divide it into two parts. DVT involving the extremities. Again, as I said, it is very, very common in the lower extremities, but sometimes I'll just give you an example. People who play violin a lot or are musicians, they can develop blood clots in the upper extremity just because of repeated use. But in the lower extremity, most common would be swelling. It may be in one extremity, some pain. Rarely you can have redness. That should prompt you to seek medical advice. As far as the lungs are concerned, then you can have shortness of breath, you can have chest pain. Again, when you go to a doctor or you're in the hospital, they look at your vital signs. You may have a fast heart rate. Your oxygen levels may be low. They may check an X-ray, and there are certain findings on an X-ray that can make you think that this could be a blood clot. Your X-ray looks relatively clear, but your oxygen levels are low. Then one could do like an EKG, and there are certain changes on the EKG that may show up. But if you have to make a conclusive diagnosis, then the most important step is doing what we call as a CTA, that is CT angiography of your chest, where you inject a dye and look at the blood vessels supplying your basically lungs. And if you see a clot there, that will be seen as a filling defect. Then you make the diagnosis of PE. And for the lower extremities, if you want to confirm the diagnosis, we do what we call as venous Doppler. So that's an ultrasound of your lower extremity where you see whether your veins compress or not. So if there's a clot, then the veins will not compress, and that's how you make the diagnosis.
Good to know. So I'm gonna ask you a follow-up question. You said the word swelling. So sometimes, I have seen people who are traveling for long hours in plane. The movement is not there, so they get swelling, or a particular climate causes the swelling. So is that a concern, or that's just a one-off?
So that's usually, if you are sitting for long periods of time, like you mentioned, whether in a plane or at home, then just because your legs, the way they are, placed, you may see some swelling or edema, and that usually is bilateral in both lower extremities. When you have DVT, obviously you can have in both extremities, but more often than not, it's one leg more swollen than the other. And sometimes you're taking certain medications that can have side effects of swelling. So every swelling is not DVT, but you have to have that sort of clinical suspicion in the right setting to make that diagnosis.
Okay, so if you have any doubt, make sure you go ahead and see the expert. So can VTE be passed along?
Yes, again, as I said, that it can be inherited. So when we see someone with clots, they come to us and we ask the history and find there are no risk factors, then we start asking, is there a family history? Again, as I said, there are inheritable causes like factor V laden, prothrombin gene mutation, protein C, protein S deficiency, antithrombin 3, and then that can certainly pass along. So if that family history is there, then, that becomes an important thing, which you can test through a blood test.
Thank you for that information. So if someone is diagnosed with VTE, and you mentioned a term blood thinner, but they cannot take blood thinners, how do we go about it then?
So that's a very important question. Like, as I said, the treatment is blood thinners. But for example, if someone is having, say, a GI bleed, and you cannot put them on blood thinners, then we can put what is called as a filter. It's called an IVC filter. This filter goes through the groin, sometimes through the neck, and it is placed in the inferior vena cava. So most of the blood clots that you see in the lungs come from your lower extremities. So if you put a filter there, it can prevent those clots from going to your lungs. I will tell you that the IVC filters decrease the incidence of pulmonary embolism, but because it's sort of an obstruction to the flow from the lower extremities, it increases the risk of DVT. So in today's day and age, most of these filters that are put are called retrievable filters. So in other words, you put the filter in when your purpose is served. For example, the bleeding is resolved and you can be on blood thinners, these filters can be removed.
Interesting. I'm so glad that we have come so far in our medical technologies that we can actually figure stuff out. So I don't know what blood thinners are, and I'm pretty sure the people who are listening to us, they are more someone like me. So what are blood thinners, and are there different kinds of blood thinners?
Yes, definitely. So blood thinners would be basically divided into what you may use some in the hospital setting, where people may have come across these terms as, unfractionated heparin or low molecular weight heparin, or another medicine called fondaparinux. So these are all given either IV as a continuous drip or through a subcutaneous injection. But once the acute phase is over, then you can transition into, now in this day and age, it's the NOACs. So these are the, or DOACs, the novel oral anticoagulants, which include apixaban, rivaroxaban, edoxaban, dabigatran. So these are all oral medications. And there's also another old time-tested medication called warfarin or Coumadin. The problem with warfarin or Coumadin is you have to have your blood monitored periodically, and there are interactions between what you eat on a day-by-day basis, which can have an effect as to how thin your blood is. The good things about these NOACs, apixaban, rivaroxaban, is that there is no blood monitoring. You take these medications, they reach a certain therapeutic level in your bloodstream, and you don't have to monitor them. So that's the good thing. And in this day and age, you worry with the blood thinners about the risk of bleeding. And just like we have reversal agents, we do have reversal agents for these blood thinners. God forbid you bleed in certain part of your body, whether it's the brain, behind your eyes, then you can reverse the effect. But the other good thing about these NOACs is they are very short acting. In other words, they don't have a long half-life. So if you stop the medicine, then it goes away out of your system very quickly.
That's good to know. Thank you so much for that wonderful insight. I do have a question that came from our live. So one of our viewers, they want to know, can they exercise while being treated for a VTE?
Definitely. There should be no restriction. Whatever you are capable of doing, you should do. So if you have, obviously, you don't want to overexert yourself, but whatever your body allows, there should be no restrictions as far as a movement or exercise is concerned. As I said, lack of mobility is itself a very big risk factor for VTE.
So hopefully whoever asked that question, you got the answer. Keep moving and make sure the risk of VTE, stays below the radar. So I don't see any more question. I'm going to come back to our question. So how long is the treatment for a VTE?
So in general, again, as I said, the million-dollar question in VTE, is it provoked or is it unprovoked? In general, you treat VTE for 3 months. But if it is unprovoked, then you have to, at the end of 3 months, have a conversation with the patient that, we probably should continue the blood thinners, lifelong, but blood thinners are not benign drugs. There are risks involved. So you have to balance the risk of bleeding versus the risk of blood clots. So in general, a first episode of VTE is treated for 3 months, but if it is unprovoked and in the appropriate setting, you would want to have a conversation with the patient and discuss the likelihood of being on blood thinners indefinitely.
Thank you for that insight. So let me check. I don't see any questions. So if you are joining us, we are live on Facebook, YouTube, Twitter, LinkedIn, and Instagram. So hop on your social media where eGlobalDoctors brings new and interesting topics. And we are talking to Dr. Katyal about VTE or blood clots, and this is the part 2. So let me quickly check, Doctor, one more second. No, I don't see any more questions. So with that, it's probably a wrap of our session. Quickly, I want to tell that eGlobalDoctors is a complete healthcare platform solution for all medical related issues and questions. And maze ki baat hai that you have these services available at your fingertips without breaking your bank and without actually leaving the comfort of your living room. So before I let you go, Dr. Katyal, any word of wisdom that you want to share with our viewers?
Again, as I said, it is a very important cause of cardiovascular mortality and morbidity. And if you look at pulmonary embolism, like the 90-day mortality is 20%. So this is something that should not be taken lightly. And whatever risk factors one has, if you can modify that, one should work towards modifying those.
That's an amazing insight. So please make sure that if you have any concerns, we have Dr. Katyal, and I'm so glad that you are there. I hope I don't have to meet you ever in these circumstances, but if I ever do, I know that I am in capable hands. So thank you so much for that wonderful session. I know I learned a lot, and I'm sure our viewers learned too. Thank you so much. This is Arjay Kunjan signing off. Take care. Stay tuned until we see you again. Namaskar.